Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each month, we deliver informative health and wellness topics you want to know about, so make sure to subscribe to us on your preferred podcast platform. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPA Cares. Now here's your host, Chief Executive Officer Kyle Longton.
Hi, and welcome to another episode of AFSPA Talks. I'm Kyle Longton, and with me is
Maddie Norton.
Maddie. It's still June.
It
This is
is.
our second episode for June, and we're continuing our focus on men's health.
Yes, we are. We just had a great episode with Dr. Kelly Rule for our last episode, all about men's health topics, including current trends. And it was a great episode. So if you would like to listen to that, you can.
Yeah, I did not buy my stack of peptides or anything like that yet.
Right.
I'm going to stick with trying to stick with a healthy diet and moderate exercise, and
Right.
and so.
The usual
Um,
things.
Anybody watching this on YouTube, I'm not going to look much different the next time you see me. Don't worry. But it was a great episode. I learned a lot. I think it's good just about preventive care, but also the risks that are out there for men's health. And it is Men's Health Month. It's Pride Month. We've done some previous episodes about that. We continue to wish a happy Pride to all those who observe it. And we've got other things going on this month, right?
We do. We do. So this will be coming out on June 22nd. And if you are wanting to join a Prudential webinar all about retirement, that will be happening on Tuesday, June 23rd. And that's offered at 3 different times. So if you are at work or can't make any of the times, there's probably a time available for you. You can sign up for that for free on our events page, aspa.org/events. So that's happening Tuesday. And then on Thursday, we will be having AFSPA Live at 11 a.m. Eastern Time. A link to the form will be in our show notes so that you can submit your questions early. And it's going to be on men's health as well, on virtual care options. So we will have a guest from Teladoc with us. And as always, me and Kyle will be there. So come prepared with your questions, or if you just want to sit and listen to us talk about men's health, you can
Right. But
absolutely join.
we'd love to hear from you either in advance or during it. Your input as our members, our listeners, our viewers makes it a better program and helps us
Yes.
offer better programming to you, and more informative. And I also want to note that there is actually an in-person event. I've been trying to get out, and as I've got meetings and other trips around the country, offering events to meet with members in person. So we did one in North Carolina earlier this year. And actually, on July 1st, we'll be doing one in the Denver area. Members who have a Denver area address have received an invitation, and I think we've only got about a dozen people who've confirmed so far. So if you're hearing this and you haven't signed up yet and you're in the Denver area, we'd love to see you there. We will have a continental breakfast. I also plan to come to New England in right now we're looking at September, more to come on that, but I encourage you to join us. And before we get too far down the line, I also want to remind people that we're in the last days of an open enrollment period for our new disability insurance program. So we launched this on May 1st. There's an open enrollment, which means no medical underwriting to get your coverage in place through the end of June. So June 30th is when that ends. You can find out more on our website at aspa.org/AIP/disability. There's a calculator there to figure out how much coverage you might want, how much it's going to cost you. And you can also apply online. So we'll include a link to that in the show notes as well.
Yes, don't miss out on that. And you only have a week left,
That's
so
right.
make sure.
Well, and Maddie, you mentioned our last episode. We talked about men's health. We talked in particular about some statistics that men are less likely to seek needed care than women. And there's a lot of reasons for that. And these can include stigma, particularly around things like mental health. Stigma still exists for far too many of us. But also logistics. Getting care can take time, asking for hours or even a full day off of work, and in some cases admitting vulnerability that we've got a concern that I talked to a family member recently that they had shortness of breath just walking around the block, and thank goodness they did admit that and get care. So, but resolving the logistics piece can help remove some of the stigma and actually just make it easier to get care. And that's what we're talking about today, how to access a variety of care options in the easiest and most affordable, free for
Yeah.
FSBP members through virtual care. And we've got a great guest with us. Maddie, can you give us a little bit of his background?
Yeah, so we have Christopher Eastburn with us today. He is a registered dietitian, a certified diabetes care and education specialist, and a national board certified health and wellness coach who specializes in the intersection of nutrition, diabetes care, and behavior change management. He is passionate about helping individuals build sustainable habits by addressing both physical and emotional well-being, translating complex health concepts into practical, personalized strategies that support long-term success. And we are so excited to talk with him today.
Absolutely. Let's get to it. Chris, welcome to AFSPA Talks. Thanks for joining us.
Thank you for having me. I'm excited to be here.
All right, we have your bio, but could you please tell us a little bit more about what your day-to-day work looks like at Teladoc Health?
Yes, so I work on the chronic condition management side of the business, mainly serving the diabetes management and the DPP or diabetes prevention program. A little bit of work in weight management as well. I act as a supervisor, so I'm involved with all of the training and onboarding of our new hires, as well as making sure that our coaches are staying up to par with the latest recommendations and following, the best customer support that they can provide to our members.
And I want to ask a quick follow-up question on your bio, just to level set for our members. I think a lot know what a registered dietitian is. They even know certified diabetes care and education specialist. But I wonder if you could just talk a little bit about the board certification that goes into becoming a health and wellness coach.
So the National Board Health and Wellness Coaching, it's one of the major coaching credentials that are available on the market. And it really ensures that I've gone through adequate schooling and understanding not only chronic conditions, but then also how to coach individuals through them. So there's a lot of practical experience where I have coaching practicals with, certified trainees, just to ensure that I'm not only meeting members where they are, but then developing plans that are well suited within their lifestyle.
Excellent. And we talked with you that our focus is on men's health this month, and I'm hoping we can touch some on that. But a lot of the programs we're going to talk about and where we partner with Teladoc um, are available to all members. And I wonder if we can use our time together to give an overview of the breadth of programs that are available for virtual care, and start with an area you're most familiar with, the chronic care management. And also with what you said, sort of is your main focus area and our longest partnership with originally Livongo and now Teladoc, the diabetes management. I wonder if you can give us a little bit about, diabetes type 2 in particular, a little bit information about that, and then also how the program can support both men and women.
Of course, yeah. I mean, when we look at statistic wise, according to the American Diabetes Association, about 40 million Americans, or roughly 12% of the population, have diabetes, with the vast majority of those individuals having type 2. And even as far as diagnosis is concerned, there's about a quarter of those individuals, so roughly about 11 million, that are undiagnosed. And that prevalence does increase with age as well. So in our 65 and over population, you're looking at about 28.8% of the population. Typically, men, according to numerous studies from the CDC, are more impacted by diabetes compared to women, but it is really something that, could use a lot more attention, that members or, patients alike could use additional testing just to make sure that they're following up with their providers and getting screened for this condition. Within Teladoc, we do have our dedicated diabetes management program, which offers personalized tools to really support that member, not only through coaching support, but then also tracking blood sugars, developing sustainable, healthy lifestyle habits, just to improve that glycemic control. And this, really helps to not only support the member in those moments where that blood sugar might be out of range, but it also really helps out with preventing any long-term complications down the road. And our program is, making strides as well. So 58% of our members across our book of business in our diabetes management program achieve remission level A1C while following comprehensive clinical guidelines. So it's not only a testament to our members' dedication to the program and, staying active, but then also the support system that our program provides to ensure that they're meeting those goals that they've established for themselves.
Excellent.
That is a fantastic statistic to hear that
Mhm.
that's happening. So Great to hear. And more prevalent than diabetes is hypertension or high blood pressure. What does this look like, and how can Teladoc help with that?
Of course, yeah. I mean, when it looks for hypertension, so recent changes have actually lowered the or adjusted the threshold for hypertension. So any blood pressure above 130 or 80 is considered in that hypertensive range. Now, usually a physician will use an average of a couple different readings in order to determine whether that individual does have hypertension. Just because there can be situations where maybe your blood pressure temporarily rises and then falls. So your doctor will work with you just to determine if hypertension is occurring for you. Um, with hypertension, there is also that kind of back and forth on whether it's more prevalent in men versus women. With that, it's a little bit more challenging just because hypertension can often show little or no symptoms. So, without regular screenings, it can progress to serious conditions like heart disease, which is the leading cause of death for men. And statistically, I know you've mentioned this on a previous podcast as well, men are less likely to go and see a doctor compared to women. So that does make it possible for this underlying condition to remain unchecked and potentially lead to further complications down the road.
So, and I'm just curious then, so how does Teladoc work? Because I know there's coaching and so forth, and I'd love to know more about that. But how does Teladoc work to monitor exactly what somebody's blood pressure is?
Yeah, great question. So it's very similar to the diabetes management program. So members will be issued a smart connected device. So in this case, a blood pressure monitor that they can use as many times as they like. Those readings are auto uploaded into their individual unique HIPAA compliant profile. So it saves their reading, it saves all their information so they can utilize it at a later date. Other features of the program include an app that connects all of those readings, but then also gives the member access to action plans where they can learn more tips and recommendations on nutrition or exercise. Maybe it's a healthy recipe that they're searching for that would be lower sodium or higher in, vegetables or fiber to help out with that blood pressure. And those are things that are available to the member, along with any sort of exercise plans or even just general information on hypertension. Not to mention the one-to-one support through an expert coach. Those coaches are really there to help to personalize the program, to make it unique for you, and to allow you to fine-tune your goals so that way it's realistic and it's attainable.
That's great. I will just first of all appreciate you mentioning HIPAA compliant. That's
Yes.
absolutely important to
Always
everybody.
important.
I'll just say, as someone who's used the diabetes program myself, I think both diabetes and hypertension allow users to export that data to very easily share it with their doctors or other providers who may want to see that and how it goes over time.
Definitely. We have our health summary reports, which are available for members to download. So if they need to share it with a specialist or if they just want to review that information in, a printed out form or if they want to email it, those options are available and it just allows for greater access and more connection between their care providers.
It
Excellent.
definitely helps to see it all out on like a little graph as well, just to see either progress you've made or see where you may have had a higher blood
Definitely.
rate or blood pressure and like what was going on then. So that's
Mhm.
super helpful. And
And oh,
go ahead.
sorry to interrupt. And it also includes, summaries too, so you can look at
Mhm.
averages of what your readings are. So it kind of gives you a better snapshot of an overall picture.
Exactly. And that's super helpful to fully understand because a lot of times you can go to the doctor and it's just numbers and it's not, connecting, but seeing a visual picture like that is super helpful for people.
Exactly. And the color coding really makes it more
Yeah.
simplistic, so you don't have to
Hmm.
interpret is this high, is this low. The
Right.
colors make it a lot easier.
Exactly. The other two programs we have in this area have been discussed a bit before and are the advanced versions that tie into GLP-1 approval, weight management, and diabetes prevention. Can you talk about these? And then how do weight and blood pressure tie into diabetes prevention?
Of course, yeah. I mean, hypertension and obesity are both common risk factors for type 2 diabetes. And Teladoc's diabetes prevention program really focuses on evidence-based resources, those connected devices that we discussed earlier, and that personalized coaching, just to allow members to really take control of their health, to really prevent the development of any chronic conditions that may, develop or, become more severe related to just managing the condition. Mental health also plays a huge role here as well. So it's always important to, incorporate some sort of mental health component into the program, just because mental health can play a huge role in overall management of the condition. I mean, if you look at something like chronic stress, that can actually create or even worsen some of those cardiometabolic risk factors. And it also can lead to maybe even issues with things like sleep quality, which can then further
Mm.
exacerbate or lead to a decrease in your metabolism and then make weight loss more challenging. So that's why really important to kind of incorporate all of these different aspects, both the DPP or diabetes prevention program, chronic cardiometabolic health with that mental health support. So you just have one powerful tool to really create long-term habits.
And, you know, at the end of May, we're recording this in mid-June, but at the end of May, we had around 5,000 people who were enrolled between the weight management and the diabetes prevention. And a significant portion of them were engaging not just in those programs, but also using the mental health support tools. So this is something that's so easily integrated and accessible to members that you may not even realize you're using it, but it's
Totally.
there to help.
And it's there as a benefit too. I mean, having that as just an add-on, something that you can take advantage of, really makes that, ability to improve those conditions a lot easier.
Yeah. And FSBP members can access all of these solutions through the Teladoc Health app.
Mhm.
And for FSBP members, you can see the chronic conditions in one area, and then you can actually toggle to the other solutions that we partner with Teladoc on, which are telehealth solutions, ways to actually access care, um, be it nutritional counseling outside of this, dermatology. And then also, I want to focus on some of the other programs we have, including one of the most popular, which is the 24/7 care. What is the situation? I think a lot of people have used this thousands each year, but there may be some out there who haven't. So, could you tell us a little bit more about when somebody might use this and why?
Yeah, so the 24/7 care is really our round-the-clock virtual care. So it's an urgent care type of platform for more non-emergent health situations. So think cold, flu, allergies, and it's quick. So within 15 minutes, you can connect with a board-certified primary care specialist or provider who then can address your concerns and also order those prescriptions direct to your pharmacy without, the need to go to a crowded urgent care
Mhm.
facility or have to deal with, long lines or wait times, you can get that support in one quick, easy visit. All of our specialists are highly empathetic as well. They provide that personalized approach and they're very thorough in reviewing not only what the condition is that you're coming in for, but then also some possible situations or medical history that could impact as well. Since you mentioned the dermatology program too, that's one of my favorites, just because it's so quick and easy. I think, it's a way to conveniently get a solution to any skin issues that you are facing. So after providing basic information about the skin issue, you also might upload some quality images through our secure platform. And then a board certified dermatologist will actually reach out within about one business day with a diagnosis, a treatment plan, and a prescription if necessary.
And I'll just add the dermatology solution severely underutilized by our membership. I think people maybe don't realize it's there. This platform is more than just the 24/7 care and some of the other things we're going to talk about. So please, if you're not sure, if you're having trouble getting in to see somebody in person, this is a great way to start. Again, HIPAA compliant platform,
Yes,
right? For any photos that
definitely.
you're submitting. And I will also add that with any of these programs, if a provider you're connecting with doesn't feel like the virtual care is adequate for your need, right? They're going to refer you to in-person care, right?
Yes,
Okay.
100%. And I mean, I think summer's a great time, especially for those dermatology visits, because we're out in the sun more often. That can increase our chances to sun exposure and sun damage. So it's always good just to kind of get those questions answered if anything does pop up that you're wanting to get questions over or answers over.
Absolutely. Especially since it's summertime, make sure you're wearing your sunscreen, members.
Yes.
And I know I just ordered some more because when you're this pale, easily going out into the sun can get you really sunburned. And I have been thinking like, oh wow, maybe I should go to the dermatologist. And so this is a great program that you could do that and not have to wait months in advance or schedule an appointment months in advance and be able to see someone, especially if it's urgent. Um, for several years, the 24/7 care was our most utilized program. However, in the last 2 years, we've seen more members use the mental health solution. How does that work?
Yeah, so the mental health care members have easy access once again high quality care through a spectrum of conditions without the obstacles of a typical in-house visit or in-office visit. So they can consult with board certified psychiatrists, licensed therapists, or board certified psychologists just by phone or video, whichever one is most comfortable and convenient for you. There you can connect with a professional just to build that ongoing relationship, discuss what issues that are really facing you, and really work on, establishing a great connection and professional relationship with that individual. I love the feature that you can select your provider as well, so you can read a quick bio of who it is that you'd like to work with and kind of choose which one is best kind of meeting your needs or offer the support that would steer you in the right direction.
And I think that is something that we can't always get when we're trying to choose somebody in person to get a sense of who they are. Is their background similar to ours? Do we feel like they're going to understand what we're talking about? And that's another feature. Being able to select a provider is something that's also available in one of the newest programs that we've partnered on, which is the P360 or virtual primary care program. I want to tell a quick story before we get into details, but when we first offered this, I was approached by a nurse, somebody who was involved in the plan and had retired from nursing, but um, this was a man, and despite his career and knowing that he should be getting care and so forth, he didn't want to do it. He didn't like going to the doctor. He didn't like waiting. He didn't. There were a number of reasons, but he was getting older. And his spouse was also a nurse, and the spouse was saying, "You got to get some things checked." He knew he needed that regular care and even some follow-up care. So he tried out the P360 and he loved it. He thought it was the perfect solution for somebody like him, or really for anybody. He liked the attention he got in the first appointment, the support in the follow-up care that was recommended after years of not getting care, and the level of communication he got from his care team. So, setting the stage there, Chris, can you tell us a little bit more about that program?
Definitely. And I mean, the virtual primary care is really designed to meet people where they are. So it's great to hear your nurse contact was able to connect with a specialist and find someone that was offering the support that they needed in that moment. I mean, if we look at on average, if we're looking at an in-person visit related to a annual exam or an annual appointment, you can look at upwards of like a 26 plus day waiting time in most U.S. Metropolitan areas. Whereas with our program, our virtual primary care offers same day appointments, and that's 20 plus minutes that you have a focused time with that provider. And these are board certified primary care providers that really, once again, like you mentioned, can be chosen by the member, just to help to build that relationship, help to, build something that's lasting and also that works through all of that member's individual needs. Not only is it convenient, it's something that also can be consistent. The program is very easy to take advantage of too. So usually before a visit, a member will receive a welcome kit and a blood pressure meter. And that's really utilized so you can work with a care team during your prep call just to gather any necessary information, maybe take a blood pressure reading beforehand so you have more time to devote with that physician or primary care provider. And then during the visit, you are, provided unrushed review of medical history with your provider, go over goals, any concerns that you might be having. And from there, that provider can refer you out for specialty care, labs, imaging, preventative screenings, just to develop a plan that really feels right and one that is shared in that decision making. It's so important for members to become involved in their care, and our providers really help to work with that member to make it individualized and make sure that you're informed every step of the way. And even after that appointment, that's when, the true bread and butter, I think, comes in because you have the opportunity to be followed up with, or, proactive outreach from our team just to make sure that your questions are answered and that you know that 24 access is there in case you need any further support. I mean, today we have more options than ever as far as what our health ecosystem looks like. And this virtual, primary care is really intended. So whether you want to take advantage of these annual checkups, whether you're using a local health system in conjunction with it, or even if you're using self-care, Teladoc is really designed to meet, the unique needs of all of our members, making sure that you feel supported, that you are able to work through your challenges, that we can adapt and be part of that system so we can collaborate together and help you, reach that true health vision that you're hoping to obtain or those goals that you'd like to accomplish.
And I wanted to sort of anchor with this program, and Chris, I really appreciate the way you sort of wrapped everything together because the telehealth programs that we just talked about are available only in the US. We do have some telehealth solutions in partnership with Teladoc outside the US, but it's not on the same level as in the US. And this is summer. We've got a lot of our members who are coming back to the US for leave or who may be in the midst of changing posts and spending some time for training in the US. And you may be in a place where you don't have a relationship. This is a great way to access care. And the P360 program in particular takes away a lot of those barriers that lead so many of us to delay care. You don't have to take off work. You're not having to devote half a day or a full day. You can do it in the evening. I think there's even weekend appointments available, early morning, lunch break, whenever. So please take advantage of these programs because all of the programs that Chris has discussed with us today are available at no charge to Foreign Service Benefit Plan members. You can use them. The chronic care programs available worldwide, and the telehealth programs available in the US, but again, no cost to members. We want you to get the care that you need. We want you to have access to that. Um, so, this has been a wide-ranging interview, kind of fast also, a lot for members. We've got other episodes about many of these programs if you want to go back in the archive, listener. But Chris, before we wrap up, do you have any recommendations or parting words for our listeners?
Of course. I mean, I tell this to all my members, it's always good to prioritize yourself and, it's okay to be a little bit selfish when it comes to your healthcare. The sooner that we're able to take advantage of some of these resources, whether it be primary care or urgent care or one of the chronic condition management programs, the faster we can get the support and just to kind of make some of those situations a little bit easier. It's good to feel good about yourself. It's good to have that health on your side. And we're here every step of the way just to make sure that that's happening realistically for you and also on your own terms.
Absolutely. And thank you so much for joining us today and giving us all of this information.
Thank you so much, Maddie and Kyle. It's been a pleasure.
Thanks again to Chris Eastburn for joining us for today's episode. For more information about virtual care options from the Foreign Service Benefit Plan, and particularly those from Teladoc Health, please visit afspa.org/FSBP or download the Teladoc Health app. This has been AFSPA Talks, a production of the American Foreign Service Protective Association. All information offered in this podcast is meant to be educational. The views expressed by the hosts and guests do not necessarily represent AFSPA. Should there be any discrepancy between information offered in this podcast and official plan documents for the Foreign Service Benefit Plan or other products offered by AFSPA and its partners, the policy provisions will prevail. Thanks for listening, and be sure to subscribe to AFSPA Talks on your favorite podcast app to catch all of our future episodes. Please rate and review us on your favorite app and stay up to date on all things AFSPA on Facebook, Instagram, YouTube, and LinkedIn. Look for @AFSPA Cares. We'll talk again soon.
Thanks for listening to this episode of AFSPA Talks. Be sure to subscribe to our channel so you'll never miss an episode. If you have any follow-up questions about the topics in this episode, join our AFSPA Live Q&A session on the last Thursday of every month. We will be streaming live at 11 a.m. Eastern Time on our YouTube channel at youtube.com/AFSPA Cares. Thanks for listening.